a serious diagnosis is received, the focus of a patient's life really changes. When that happens, children expertise care team becomes very critical because that would be very important for the efficiency of the intake, for the clinical outcome that finally received. So at LINKMedicine, what we're focused to do is to build a data-driven medical expertise navigation platform to really empower the patients to make more informed decisions. So we already know that children in the hospital is difficult. Well, if we choose hospital by expertise, that will be more challenging. But is that necessary? Let's take the shoes of a few patients, like Mr. Sam, who is diagnosed with pancreatic cancer. For most hospitals, if their surgeon are in lack of expertise to perform the surgery to remove the cancerous tissue from the patient without harming the fragile pancreas, well, most hospitals would be unable to really doing that. They should decline these patients. While if other hospitals would like to do that, that will put the patient into great danger. Another patient, say Ms. Jennifer, she is diagnosed with essential thrombocythemia. I'm glad I can still pronounce that name, but it is rare. It is a really rare disease for a very rare blood disorder. And for that particular disease, in her local hospital, the physicians probably have never seen a steady stream of patients like her. So it is really not to their expertise to make precise diagnosis as well as make the optimized treatment option. Well, the third patient I'd like to introduce is Jack, who is suffering from liver cirrhosis for a long time, but the disease prognosis is still continuing. So for Mr. Jack, he is really in the need of medical second opinion to think twice regarding how to manage his health. So for Mr. Sam, Ms. Jennifer, and Mr. Jack, the expertise medical provider are really in the homes to really help them address the medical problems. So why is that difficult? Well, because of this portfolio of disease and hospitals are really like finding the needle in the haystack. There are so many different types of diseases, as well as so many different hospitals. In the expertise for a particular disease vary from hospital to hospital. If we rely on just traditional method to do this selection evaluation, we are going to fall into some pitfalls, such as find the most reputable hospital. However, we know that expertise is not equal to reputation. Even the top one hospital or the most famous hospital has not every disease is really the most expertise. In fact, from our data platform, we have revealed that the top one hospital with the most number of expertise disease only covers 50%. The other 85% of the disease, their experts are scattered across this entire nation. So there is really unmet medical needs to really find the medical providers by expertise. If we do that traditionally in the agency way, I mean primary care provider, or you refer from local hospital and so on, the patient will be referred to a collaborating hospitals or network. While if we just try to do that by ourselves, in fact, there is more and more patients are trained this way. 70% of the patients in the United States are trying to search online to find medical information before they do medical appointments. However, trust me that if you do that Google search or rely on your families and friends that are as clueless as you, finally a lucky hospital will be chosen. So our solution is different because we really deserve more, and we use big data for that big decision. So how this really works is that we collect the patient data and marry that data with the hospital expertise data. That is subject to the data analytics platform from LINKMedicine, and expertise hospital or expertise hospitals will be chosen to address that medical So how this really works? Let's look at this our core platform, the LINKMedicine web portal. So it's rather straightforward. That 3 steps: input your data or disease, and obtain the insights, and action can be taken. And this is how what's under the hood. So the patient data will be collected, and those data points will be computed into different expertise data matrix. And we illustrate this expertise data in a way that ordinary patients can somehow understand by expertise mapping, by top hospital recommendation, as well as compare them all in order to do that. And we also build an advanced analytics model to really support holistic consideration for their informed decision. And compare with the traditional methods, including latest model, local hospital, referred hospital, and even just DIY model, we really excel in terms of expertise level, efficiency, confirmed interest, coverage, and a lot of other ingredient that's critical for your rational choosing of the medical provider. I like to emphasize this part, the U.S. news part. However, whenever you talk about the best hospital, the first thing we think about will be the U.S. news and the World Report. Well, that is a great deal you mentioned 30 years ago, where you put everything online and you can compare those stuff in one place. It's like Yahoo like 20 years ago. However, in this big data artificial era, we really deserve more. U.S. news compare stuff like in reputation in terms of specialty. However, when we think about something like cancer, for example, this year MD Anderson is ranked as #1 for cancer care. But how many cancers are there? Do you think each and every one cancer? MD Anderson is the best choice. Honestly, it's not. For instance, brain tumor from our analysis, Duke Medical Center probably is a better choice. And there are 200 different types of brain tumors. When you narrow down to each different disease, well, the analysis result will be different. So in this year of artificial intelligence and big data, we as medical patients really are empowered through LINKMedicine to choose medical providers by expertise. So we set strengths from the technological platform. So we can build different business model to meet the direct-to-patient model as well as B2B model through our different product line. For instance, data analysis, direct referral, consultation appointment, medical second opinion, those extended technology-enriched services. As well as we can form strategic collaboration with like B2B model with institutions as well as service companies. So this technology